Hey everybody, Dr. Carlo here. We just had this patient arrive to the emergency department with dry lips, nausea, vomiting, sugars critically high, won't even read on the blood sugar monitor. And this is her EKG. Looking at it, obviously it's a little fast. If we don't have the machine counted out and we look for one of the QRS that touches a line here. So we know over here would be 300, this would be 150, 100. So it's more than 100. But less than 150, so probably like 110 beats per minute. Axis, positive, 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 so normal axis. QRS looks narrow, so there's no conduction defects. But what really jumped out at me, and hopefully you guys can see, I'm going to give you a moment to pause. Something jumps out at me as being not like a normal EKG. Can you see what it is? All right. Hopefully you're getting this. Look at the T waves. They're almost as high as the QRS complex. Here is even higher than that. Oops. Even higher than that. Look at that. It's so much higher. So T waves are very large. Almost as large as the QRS complex. Look at that. And over here, that's called hyperacute T waves. And in this context of this patient with hyperglycemia and dehydration, you have to worry about potassium hyperkalemia. Of course, we're giving fluids and insulin, so that'll help treat that even if we're not treating per se. But let's see what the blower shows, and then we'll see. So guess what happened, guys? All of a sudden, they come into the room because the patient's of ventricular tachycardia. Heart rate in the 200s. This is what it shows. Now, we already knew from the initial EKG, we suspected her potassium to be up. So we ordered some calcium chloride. We pushed IV, and ton, 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 ton. This is after that. So she was definitely hyperkalemic. Her potassium ended up being 7.5 and extremely acidotic. Her pH was 6.8. Her PCO2 was 5, which is really low. So we ordered some bicarb. The potassium is being treated by fluids, being treated by insulin, giving IV. And of course, ketoacidosis is the resin that binds potassium and actually removes potassium from the body. But she's too altered to really swallow it. So my helper here says, put an NG tube and drop it down. So we're going to do that. We're going to put an NG tube and drop it down. What else can we say? We couldn't have good access. She had a tiny little IV in her thumb here. So we put a central line on the groin under ultrasound guided. Yes, initially I hit the artery first. We pulled the thing out. We put some pressure. Went again. Got the vein right away. Put a central line. So now she's getting aggressive fluid hydration. Her heart rate's improved. And now we end up not having ICU, so we had to transfer the patient. So a lot of things to learn here. Obviously, early recognition of the hyperkalemia by the EKG helped me because without knowing the potassium level, I was able to treat the ventricular tachycardia that happened subsequently because of the high potassium by giving calcium chloride IV and resolve the ventricular tachycardia, which obviously could have deteriorated into a more lethal arrhythmia in this particular patient. So what else can we say about this DKA patient, Star? Anything else? Anything else we discuss? Oh yeah, what about sepsis? So why is she in DKA?
Because it could be multiple reasons. One, she wasn't adequately controlling her insulin. She did have an insulin pump.
Right, the insulin pump stopped working.
Yeah. Or two, because I think the battery looked like it was dead, but two, she could have a source of infection that could have caused it.
So what else tells us that there's an infection going on her? Do you remember the blood work?
Well, no, I don't.
She had a 20,000 Y count.
Okay.
Her lactate ended up being 7.5.
Oh, wow.
And what else with the temperature? Remember, they told us that her temperature was
hypothermic.
Hypothermic. So sepsis is not just hyperthermia like fever, it can also be hypothermia. So we put on a bear hugger to warm her up, giving fluids, antibiotics. We're gonna get a cath urine, get a chest X-ray on her, and get her transferred out of here. Oh, there they are.